Uh, we have
Good
to start.
evening.
Hello, Mirjana. So, welcome to tonight's talk. Our speaker is Mirjana, that we know very well. And the topic is, O ye of great wealth and poor health, for powerful and notable people in the Renaissance Florence, diseases and healthcare, the Medici family. So, third part of the talk on the Medici family. So welcome, Mirjana.
Thank you very much, Terence. Tēnā koutou katoa. Good evening, everyone, and welcome. Salvete omnes, nomen mihi Mirjana est. Gratia vobis ago, cum veneritis hac vestera. And I won't torture you any further with Latin, because tonight we are entering the modern century in the Medici family. So we will see how modern they were in comparison to nowadays. And buonasera e benvenuti a tutti, of course. Now, we are in May, and May is, for me, a month of lots of celebrations. We had the 70th Eurovision Song Contest, and whoever is from Europe will know what that means. And for the first chocolate, whoever answers correctly, what was my favorite song at the Eurovision Song Contest? From which country? Bulgaria. No, Bulgaria. It was good. It was good. Italy. Oh, the first. Oh, Salvatore from Napoli. He sang about marriage and love and beauty. It was, but the winner was Bulgaria, yes, and also the Australian lady. She was also very good. So, as I said, May is the month of celebrations. Here you are. Recently, I celebrated my 10th anniversary of being a New Zealand citizen. It was also my 10th anniversary of being of graduating with a psychology degree. But most importantly, what I'm very happy to talk about is on this day, 40 years ago, I mean, a few years ago, I arrived in Italy. I was very young, and my job was to look after two boys. My great wish was to learn Italian, and very little did I know that 4 decades later, I would actually be reading Medici documents, Medici records, Renaissance records in Italian, and all thanks to that trip. So, what happened? When I arrived in Italy, at Castiglione della Pescaia, I looked after two boys. One was 5 years, one was 8 years old. I knew only 4 words in Italian. La mamma, bambino, grazie, e buongiorno. That was all my Italian. But believe me, within 2 weeks, my medical terminology in Italian skyrocketed. And I'll tell you what happened. So, because my knowledge of Italian was very, very limited, the little boys, they decided to help me with some of the words and how to get through as easy as possible. And so they would probably say the word, and I would say, che cos'è? What is this? And then they would show it what it was, like la sedia. I would say, che cos'è? It's the chair. And so they said, la tavola, il tavolo, that was the table. And then the little boy, he said, scureggia. And I said, che cos'è? Well, he didn't point. He passed the wind. And from that, in modern turn, you would say he let it rip. Is that correct? So when we talk about the modern language, so that's probably what would be the real term. So the boys were also arguing a lot. And believe me, through their argument and the words like idiota, scemo, cretino, non capisci niente, which was my favorite, which means you are thick. you know, believe me that the knowledge of my various layers, good evening, welcome, the knowledge of my various layers of intellectual disabilities, mental health was enormously improved. And also, and then of course, I scolded the boys and I said, well, no, you can't teach me those things. So they taught me a song about a family, they go bon. And whoever learned a new language, how many of you learned the word a hunchback? Well, that was the song about the family of the hunchbacks. And that word, la gobba, means a hunchback, was so useful when I was researching Ferdinando I, who had the symptoms of the torticollis, and which looked very similar to the hunchback. So it was very useful. And the words like, I don't know, scureggia, puzzo, mudante, tutte queste parole, all those words meant that my knowledge of Italian was much better. While 2 weeks later, I was still pointing at a pair of shoes that I wanted. Believe me, I understood very well the medical terminology. Okay, so now we are getting to the 16th century Medici, and we are talking about the Grand Dukes of Tuscany. So whoever was here last time knows that I spoke about the secondogenito, which means that was the cadet generation. And here we have the Grand Dukes of Tuscany. I will show you very soon the whole family tree. So here we've got the Grand Dukes of Tuscany. There were a total of 7 of them. There were 3 Cosimos, there were 2 Fernandos, there was 1 Francesco and 1 Gian Gastone. So here we've got all their names and who they married. So out of all those 7, is there anything that you can notice? They all married foreign wives, except for Vittoria della Rovere, who was Ferdinando II's cousin. So why is that important? Because we will see later on that all of the pathology was not only what they inherited from their Medici line, but also what they imported through their wives. Okay, so if you remember my first talk, we had Mugello, we had Cafaggiolo, and we had Trebbio, 2 villas. One was in Cafaggiolo and the other one was in Trebbio. There was Palazzo Medici near the cathedral, but as of the Cosimo I, we have a grand Palazzo Pitti, and it was just magnificent. Later on, there will be some adjustments, there will be some enlargements, but it was something that actually symbolizes the status. And later on, we will see at Ferdinando II that Palazzo Pitti was considered one of the most beautiful palaces of the 17th century. Right, so we are talking about the Medici of Cafaggiolo line. Often people ask me if there are any Medicis still living today. Of course they are, but they are not of that line. They are not direct descendants of Lorenzo il Magnifico, Cosimo I, or I don't know, Catherine de' Medici. Yes, there are some in French, in France or in French region, but none of the Cafaggiolo line lives today. Direct line. So here we've got a family tree. In our first talk, we did 7 of the oldest: Averardo, Giovanni di Bici, Cosimo Vecchio, Lorenzo, Piero il Gottoso, and Lorenzo and his brother Giuliano, who was assassinated on the Easter Sunday. Then last time we spoke about the secondogenital line or cadet generation, which is this one. So here we've got the primogenital line, and here we've got the secondogenital line. Oops. And today we are talking about the last 5 Grand Dukes. So they all originate from Lorenzo. Giovanni delle Bande Nere is very important because here we've got Maria Salviati, who was Lucrezia's daughter. So she was from this line of the Medici, from the primogenite. So basically those 2 lines merged. And then we've got Cosimo I, and later on we've got all the rest. So Cosimo I was the first Grand Duke of Tuscany. Here we've got the line of the Cosimo I. Francesco I was the second Grand Duke. We also spoke about him last time. He was the one that was an adulterer. Then this time, tonight, we are going to talk about Ferdinando I, his son Cosimo, his son Ferdinando, his son Cosimo. And here we've got in capital letters Ferdinando, who was the firstborn to Cosimo III. But unfortunately, he died of syphilis before his father passed away, so he could not inherit the title. So the dukedom was passed on to Gian Gastone. Gian Gastone had no issues, so technically the line ended with him. But there is his sister, Anna Maria Luisa, which later on we will see that plays a very important role in Florence even today. The first line of the primogenito, birth and death of the early Medici. So we are talking about the mid-14th century. We use the first as the Averardo because we have most of the information. And he was the first one that arrived in Florence from Capaggiolo. So he lived in around 1360. We don't know how long he lived, but here is the age at their death. So the first 2, Giovanni and his son Cosimo, the elder, they lived quite old. They were quite old for the 14th century, 14th and 15th centuries. While the later generation was in their 50s. I would say that was probably the average age at that time. Giuliano, here we see that he lived only 25 years because, as I said, he was assassinated. The secondogenito generation, so we are talking about the line stemming from the Lorenzo, Cosimo's brother. Here we've got Cosimo I, Francesco, Ferdinando, and then we just added last time Catherine de' Medici because of her role at French court. So she lived a lot, she had a long life, 70 years, but here we've got, I would say, again, rather average length. There were 3 popes. The Medici gave 3 popes, Leo X, Clement VII, and Leo XI, and they gave, I think, maybe 12 or 13 cardinals. So they were quite religious and quite actively in the life of the church. Here we've got the line of the last Grand Dukes. So here we start with Ferdinando, Cosimo II, Ferdinando II, Cosimo, Gian Gastone. And so here are the age of at their death, which was 60, 30, 60, 81. He lived the longest, but he was not a nice man. And Gian Gastone, he only died at the age of 66. Anna Maria Luisa, she was widowed. She married a German guy who died of syphilis. And although they believed that she might have also been infected by syphilis, I mean, quite frankly, in those days when they didn't know any treatments, I don't think that she would live that long with syphilis. And then when they when they dug up her grave and her coffin, they did the analysis and actually she was not infected with syphilis. It is very likely that she died of the breast cancer. We will talk about that later. So here we go again to the Medici family tree. Very often I will put the line so that you know that you can orientate yourself who are the people that I'm talking about. And another thing that I would like to tell you is that in this talk, I'm not going to talk about the Medici women or wives, because there will be a complete different talk. They are absolutely interesting. There has been a lot of gossip, a lot of quarrel at the court. I think I've got only one to mention, and you will know why. So yeah, let's start with Ferdinando I. Before that, so here is the list of all the diseases that the Medici family members suffered from. So in that first primogenitor line, so that was the left one, we've got Averardo, and we don't know what he suffered from. We also don't know much about Giovanni di Bicci, except that he suffered from catarrh and that he was of quite good health, but we don't know much. Cosimo the Elder, he is the one that is quite interesting. He had kidney failure. He suffered from chronic urinary diseases. He was absolutely devastated by the rheumatic pain, and he also suffered from the enlarged prostate. But these are the first generation, is the generation that I talk about in my first talk. And then we've got Lorenzo the Elder. He was Cosimo's brother. So Cosimo was primogenitor line, Lorenzo was secondogenitor, or the cadet line. Lorenzo the Elder, he suffered from dysentery and infirmity. Cosimo's son, Piero de Gauti, that was his nickname. He was actually suffering from gout, but in those days, they considered gout as any kind of rheumatic or arthritic disease. So everything was a gout. But we will see through the generations that actually they were quite infected, and it was their hereditary disease. So here we've got gout, we've got uricemia, we've got also the cerebral lesion, which aphasia. So he had difficulty talking. And I don't know if you watched the series called Medici, Masters of Florence. Piero de Gauti was quite well depicted, even though that the story was quite fictionalized. The characters were still there, and they were quite well done. And then we have Lorenzo the Magnificent. He was, oh, poor man, he died quite early. He was not even 50. He suffered from arthritis deformans, and he was completely bedridden toward the end of his life. And we've got his brother Giulio, who was assassinated in the Pt3 conspiracy. The cadet generation is something that we spoke about last time. So we spoke about Cosimo, who suffered Cosimo I. He was known as the very progressive, very visionary. He was patron of the music. He was patron of the artists. He built Uffizi, which used to be his offices. Nowadays, it's a museum. And so he was a man of future, I would say. Unfortunately, he also died quite early. He suffered from stroke, uricemia, enteritis, and dish. Dish is, we will see later, because his son Ferdinando I suffered from the same disease. This is where the posterior longitudinal ligament in the spine starts to ossify. And instead of a ligament, you have bones. And so the movements are very, very limited. So let's see our five guys for tonight, what they actually suffered from and what was their life like. So we've got Ferdinando I. He suffered from cardiopulmonary failure and DISH. It's called DISH, the abbreviation. Then we've got Cosimo II, his son. He died of tuberculosis, and he actually died very young, only at the age of 30, 31. Then we've got his son Ferdinando. He suffered from some enterocolitic multiforms, echinococcal multiformans, which was the parasitic lung disease. And he also had ictus following dropsy. So he had also all sorts of diseases. Cosimo III, I don't like that guy. He was mean, and he was fat, and he was, oh gosh, he was pathologically religious. So you can imagine how people had to tiptoe around him. He died from uricemia, which was a common disease among the Medici, and so did the Gian Gastone. But Gian Gastone, he was the last one, and he was really the man who could say that he showed everything that the previous generations didn't have. So he is really the man of the modern age for the Medici. He was obese. He suffered from lithiasis, from the stones in the kidney. He was, he had all sorts of enterocolitis. He was very sick. So here they are, those Grand Dukes. So there are all 7 of them. That's Cosimo. What do you see on him? I mean, apart from all his mighty regalia, would you say that he was showing the signs of a little bit of overweight, if not obesity? His son, Francesco, he was the adulterer, or he was also a nasty piece of work. So he was, yes, he was cheating on his wife. He helped his lover kill her ex-husband so that they could be together. So it was all sorts of things. Here we've got Ferdinando. Actually, I do quite like Ferdinando. He was very moderate in everything. He was, until the age of 40, he was quite all right, or fairly quite all right. But as of the age of 40, he suffered a lot of problems with his health dish. So that was the ossification of the posterior ligament in the spine. He suffered from uricemia. He had a lot of problem with visceral organs in the abdomen. So poor man. Even though, you know, he seemed to be quite perky. And there is one thing that particularly I like about him, and you'll know later. Here we've got Cosimo. What do you see about Cosimo? You could tell by his constitution here on the photo. He was suffering from the TB. If you remember from my previous talk, can you remember for the chocolate, of course, who else suffered from the TB in that recent generations? His grandmother, Eleonora de Toledo. So she died also of the TB. So here you could see him. Let's say that the average height of the men in Florence in that time period would be about 165, 166 centimeters. So that would be something like me without those stills. How do you call those? Oh yeah, those. And approximately the average weight would be about 58 to 60 kgs maybe, which would make me a giant in comparison with their men. But they say that Cosimo, with his full regalia, he weighed only approximately 54 kgs. I mean, he was really petite, but that was because he was so sick. Then we've got Ferdinando II. He was a man of science, and we will see, oh, he was a friend, and he was tutored by none less than Galileo Galilei, which was really, really something special, and we will talk about that. And then we've got the Cosimo, the nasty. I would call him the nasty. Yeah, he married a French woman, Marguerite de Orleans, and she mocked him in public. Oh gosh. So those marriages, some of the marriages were beautiful, some of them were really disastrous. And here, the last one, here we've got the Gian Gastone. Oh, he enjoyed gluttony, he was alcoholic, he was gambler, he was bored because he was living with his wife somewhere in outside Prague, and he didn't like the weather. He was very melancholic, and also Cosimo III, his father, they did show visible signs of melancholic mood. Nothing could perk them up, but anyway. So here we are going to talk about Ferdinando. Ferdinando di Cosimo. He was born in Florence in the mid of 16th century. He first started to be around the cardinals at the papal court in Rome, but because his brother Francesco, if you remember, the one that was the adulterer, he died. And so it was Ferdinando who had to take on the dukedom after his father's passing. And so he was, at a very young age, he went to Rome under the guidance of Cardinal Agnolo Nicolino. And when his father died, at the age of 38, became the third Grand Duke. He married Christine of Lorraine. So she is now a very interesting character. I'll tell you about her a little bit later if we have the time, because through her, all the genes or gene pool that went to France through Catherine de' Medici actually came back, because she was the daughter of Catherine de' Medici and Henri II, who was the King of France. She was their daughter, and she married the Duke of Lorraine, who was descendant of the Danish king, and his wife was from Austria. So that's very interesting. And so this photo shows him with a cardinal cloth, but actually he never took the sacred order. Is that how you say it? And in this photo, we can say that he was quite of good health, that he was quite perky, he was quite strong. And they do say that when he was born, he was of good physical build, enjoyed good life until the age of 40, when things started to go wrong. It's interesting what they say about him, that he got his first tooth, or they saw that the first tooth was growing at the age of 14 months. And then at the age of 18 months, he had 3 teeth, which is fairly late. And some of the documents that I had access to actually did indicate that his dental health was quite poor. So yes, so we here have that he was handsome, happy, naughty boy. He did suffer the major infection at the age of 13. It's believed that it was the malaria fever. And if you go back to my talk where his brothers Giovanni and Don Garcia, got caught, and they both died, and their mother, Eleonora de Toledo, also died shortly afterwards. So he managed to pull through. So these are all listed what he suffered from. But despite all that, he actually managed to enjoy life. And here is what he did. And I would like you to sit now very comfortably and just enjoy. All right? There we go. Read the first line, and I will let you now enjoy a little bit in the Figaro. I've recharged my batteries. Whew, that was good. Okay, so this is the dish pathology that we spoke about last time. These are the X-ray from the Cosimo I Medici, but this is actually the same pathology that Ferdinando also suffered from. Now we are going to the next one, his son Cosimo II. So we are here. Cosimo married Maria Maddalena of Austria. And if you remember last time, we spoke that Francesco I, his uncle, also married an Austrian princess of Habsburg monarchy. And just if you remember, there will be a question about that. What was one of the very prominent facial characteristics of the Habsburg monarchy? So please pay attention. So they had 2, 4, 6, 8 children, and the oldest was Ferdinand. So he was great patron of science and letters, and he was Galileo Galilei's student. So when I researched about the Cosimo II, who was the fourth Duke, the first sentence that I found anywhere was "È la storia d'un tuberculoso," which means he suffered from tuberculosis. He was born healthy, but very of a delicate child. And at the age of 20, he showed the first sign of habitus physicus, or the signs of consumption, TB consumption. And the doctors that treated him described him as a very frail and thin. So as you can imagine, being at the court of the Medici, of course, you will be seen by the best doctors that there is to offer. So they also had the opinions of the Portuguese court or royal doctors, Spanish, etc. So his mother was very superstitious. So the Christina of Lorraine. So she passed that religiousness and superstitiousness to his son. And so he thought that that was probably some kind of punishment from the god. And he lived like that. So his ability was, I'd say, just average, maybe even below. He was able to write from the very early age, but then he was quite dysgraphic. And he was all, I mean, being consumed by TB, of course, you would be lacking energy. He was taught by Galileo Galilei, although Galileo taught at the universities of Pisa and Padova. And so he would teach young Cosimo during the summer break. So that worked well. He inherited his father's title at a very young age, and unfortunately ruled Tuscany for only 12 years until the age of 30. He married Maria Magdalena, the Habsburg princess, and the ceremony was very lavish. And his father, Ferdinando, he actually did the opera piece. He commissioned an opera piece for the lavish wedding. And just one disclaimer, although we were listening to Gioacchino Rossini and Largo al Factotum from his Barbiere di Sevilla opera, unfortunately, he came a little bit later. So we are talking about the mid-18th century. But it was Ferdinando who introduced opera to the court. And the first recordings were related to the Greek tragedies. Unfortunately, they are in no existence. So, but I thought you might like Largo al Factotum. So he and his wife had 5 sons and 3 daughters, and they all lived into adulthood, because later on we will see some of them really struggle to have their children follow the line. So he was suffering and showing the classical symptoms of the gastric ulcer, and he was showing also gastrorrhea, which was the blood in the stomach at melena. Melena was very dark stool, dark dry stool, and then he would have the episodes of profuse diarrhea. He basically didn't have much of a treatment. They were trying to make him as comfortable as possible. But he also were showing some swellings in his right knee, his foot, and they also assumed that it was some form of the rheumatic arthritis, and they called it gout, as I have already explained. He died on 28th of February, 1621. And the autopsy revealed ulcerous biapical pulmonary lesions with retracted scleral tissue. So basically, the TB was on both on top of his lungs. So just here, just to say that Maria Magdalena of Austria, she was described as somebody quite commanding, quite demanding, and she did not get very well on with her mother-in-law. But actually, they had to look, they were regents together, to the to the young son that inherited Cosimo II. So that was the Ferdinando II. So, and it is also, which I found quite interesting, there were talks about that she, being from a different court, actually started the decline of Florence. So we are going now to Ferdinando II. And there is he was an inventor. There was a scientific uprising. His brother was into science. He was into science. Galileo was there. He was perpetuating the thermometer that Galileo designed. But there was the start of the economic decline of the Medici family. So he was quite a long ruler. He ruled for 49 years, but not as long as his son would. His son would rule for 53 years. So his grandmother Christine and mother Maria Magdalena were full of pomp and arrogance, and that's why I said they didn't go well on at all. They both served as regents. He was weak and meek politician. He was apparently the peace promoter, but they never knew on which side he was on. So he was here, not there. But basically, he was just interested in science, and he was an innovator. So yes, here I've got, oh yes, he even was looking at chickens, at what temperature they would hatch and how, and he was just all into science, not into politics at all. He enjoyed music. He was okay with the literature. He was quite physical. He liked sports, gaming, riding horses, going hunting, swimming. He was also a contributor toward the Palazzo Pitti, just like his father. So they were enlarging, and so they wanted to show all the grandeur. He was of very moral standing. He was honest. But there were some rumors which have never been really confirmed about his sexuality, which was, we don't really know. Some people say, yes, he was sexual. Some people say it's doubtful. So there is the publication Vita di Ferdinando II by Orlando and Bacini, but it was published about 70 years after his death. So how authentic that was, I'm not sure. So he was the one that at the age of 13, he was betrothed to his cousin Vittoria della Rovere. She was 12 years his junior. So you can imagine she was betrothed at the age of 1. Yes, I mean, indeed. And actually, in just one sec. In 1634, they actually did get married, but just to make sure, because she was orphaned, and so her grandmother wanted to make sure that she marries well, so she pushed her even at the age of 1, and then at the age of 13 or 12 or 13, so they were legally married, but the marriage was not consummated. Is that what you say? Until she was 15, but I mean, oh no, really. And the marriage, as you can imagine, was not a happy one. Apparently, it was all her fault. She was fickle, she was capricious, she was frigid, in affection, emotions. So, it's always blame the woman. And but that Ferdinando, he was into science, he was not into women, and he was, if it's true that he was more inclined toward men, I don't know. But he was quite responsible. So when there was a quite heavy outbreak of the bubonic plague in the period between 1630 to 1632, and he himself, there were several accounts of the historians of that time that they saw him walking through the streets of Florence, bringing the essentials, the food, and I mean, he was there. So he was the one that was suffering from echinocosis granularis. It might have been benign, but there are also those that are saying that it was multiformis. So He was obese, has got some respiratory problems in those time period. Being obese, you know, what was he eating? Was it a game like it was with the first Medici when they were eating only game, lots of protein? We don't know. It is reported that he died of ictus following dropsy, but the autopsy showed that he also suffered from heart failure. Heart failure. Kidneys, pancreas were normal, but his liver, so he had a fatty liver. He had also gallbladder with chalked and small stones. So there, it seems that their pathologists were quite onto it. And yes, he was also the 20 centimeter long polyp in the left ventricle of the heart. So now we are going to Cosimo, the one that I don't like. So we are going, now you will hear about him. So Cosimo III, so he was the longest reigning Grand Duke. He was 53 years old. So he was, because he was so under influence of his mother, grandmother, so he was all about religion. Everything was religion. He even collaborated with the Inquisition and so he was reported, well, his early education was very strict and it was all toward religion. And so he was quite rebellious. He was stubborn, he was easily bored, he was vain, clumsy. So, you know, he could. He was, I mean, he was the future Grand Duke. His character was described as weak, dark, and mystical. And I found it actually in several places. However, as a child, he showed to be precocious hunter. That's also something that I found in several places, that he could kill a goose. Thank you. He could kill a goose, you know, in the air. You know, he was so, when he was in a good mood, that's another thing. So he grew up healthy boy physically and mentally. He was very well nourished, well developed, normal proportions between the cranium and the face. So that's how they were looking. But that was when he was a boy. So until the age of 17, he was all functioning well, industrious student, intelligent, learning different languages, cosmography, etc. But then at the same age, he started to show the signs of melancholy mood, and he never smiled, unlike his father, who was, you know, science, you know, let's do something. And he always sought the refuge with the, how do you say, friars, with the clergy. He was all about, he was more exercising his spirit rather than his physical body. And what they thought, you know, what usually people think that is the answer to all the questions, he thought that if he got married, you know, all his problems with the melancholy will go away, which were not. I mean, the marriage was disaster. At the age of 18, so just as he started showing the symptoms of melancholy, you know, they married him off. And he got married to a French woman, Marguerite Louise d'Orléans. And that was forced. She was not happy. He was not happy. Even King Louis XIV intervened, and he also suggested. And she was. I mean, she was a wild bullet. She would just take off, and she even left her children at the age of 4, and she just went on. And then eventually she ended up in the convent. So it was Vittoria della Rovere. It was the grandmother that took care of the young ones. And so they were all religious and really, they were very religious. So she mocked her husband in public, did not listen to anybody's advice. Somehow they managed to have 3 children. The heir apparent, Ferdinando, and Ferdinando is the one that died of syphilis before the dukedom could be passed on him. And Gian Gastone became the Grand Duke. So Gian Gastone was the second son. So he tried, he was actually trying to help his daughter. He knew that there was not really much going on with Gian Gastone, and he was trying actually through changing of the laws, ensure that his daughter, in case there are no male issues from the sons. There was no, because Ferdinando suffered from syphilis, so there was there was a sterile marriage. There was no issue. So he tried, if Gastone didn't produce any heir, to pass on the dukedom to Anna Maria Luisa. That didn't work. And so he was quite grumpy and he was very, very unhappy about that. And he was a very cruel man. You know, he didn't believe in love, maybe because he was in a loveless marriage and he didn't believe in love. And he made other people suffer from love. And once when we have a little bit more time, I'll tell you all the atrociousness that he did. And he was persecuting Jewish people. As I said, collaborated with Inquisition, described to suffer from emotional and intellectual paranoia primitiva. And I mean, didn't like him. He loved food. He was gluttonous. He lacked self-control at the table and drinking wine, and he was prone to gain weight. And we could see that he was, well, you know, not a nice man. And the autopsy showed that he died of nephrolithiasis, so he had stones in the kidney, hereditary uricemia, a stone in the left ureter, and he had cystitis and heavy hypertrophic prostate. No wonder he was grumpy. And we come here now to Gian Gastone, the last one. So he was the last Grand Duke, and he also ended, that was the end of Medici line of Cafaggiolo. So just like his father, he showed the signs of a melancholic mood even earlier at the age of 13. And he had the first big attack of melancholia at the age of 20. No wonder, because Margherita de Orleans, she left him at the age of 4, so he was raised up by granny, so that was also a story itself. And then at the age of 20, he was interested in the art of selling wool. But he had those ups and downs. You know, one day he was so enthusiastic and he wanted to contribute toward the Florentine economy, and he was interested in silk and wool and everything. And then 5 minutes later, oh, he was all lethargic. And I mean, he was obviously not well. So, and the people who tried to help him. Okay, yes, they saw that his father was melancholic. He was melancholic. Okay, his sister, Anna Maria Luisa, she was very ambitious. She wanted to marry him off. And that's in my flyer. That's what I said. What was the relationship between brother and sister? He couldn't stand her because she made a living hell of his life through his marriage. So he was married off to, let me just see what's her name, Anna Luisa, I think, Anna Luisa, okay, sorry, Anna Maria of Saxe-Löwenberg. She had a big field outside Prague, and he didn't like the weather. He didn't like that she preferred horses. He had no company. He described his days eating, sleeping, drinking, eating, sleeping, drinking. And then he went for trips, different places. He got into bad people. He got into drinking. He got into gambling, and he amounted big debts. So he was living in Prague. His wife was living outside on her countryside, and his father was appalled. So his father paid off his debt. So that was Cosimo. And then he said that he had to come back with his wife, and that didn't work. And then he blamed Anna Maria Luisa, his sister, that for 11 years of very unhappy marriage. And then in the end, he came back to Florence. She became a widow because her husband died of syphilis. They were in Düsseldorf, and so it was, yeah, they were all much happier in Florence. So, so Gian Gastone, what was he like? He was of frail constitution, suffered from headache or gastritic pain. However, he enjoyed more than reasonable visceral health. However, we will see that he actually died of the whole thing of factors that contributed. So he suffered from oliguria, which is lack of very little urine. Then later there was anuria, no urine, chronic diarrhea, conjunctivitis, blepharitis, which is, you know, when you have a sty, so this is the chronic form of the sty, styes is the acute form, and the autopsy showed that his kidneys were enlarged, small stones in renal pelvis, so he had all sorts of complications and things. He also had the enlarged heart. However, spleen and liver were really in a good condition. He also suffered from uricemia, which was the trait, and so that was the end of the line. However, his coffin was dug out as a part of the Medici project, and where his coffin was in the Cappella Medici, when they lifted up, they actually went downstairs. There was another room, and they went downstairs, which was full of coffins of the small children, and this is also where was Gian Gastone's. That was in 2015, and they lifted them up and they dug them out because some of those coffins were damaged due to the flooding in Florence in 1966. And here we come, just one more, very briefly. Why is Anna Maria Luisa so important? Because she was a lady of the vision. So, as I said, her marriage was harmonious, although her husband had syphilis, she miscarried. But when she was widowed, she came back to Florence. Gian Gastone, her brother, he expelled her out to another villa. But as he didn't have any saying in who is going to inherit the duchy, he did a clever thing, and I give him credit for that. He started separating the wealth of the Medici, their personal wealth, from the state wealth, and she inherited all the wealth. Upon her death, because there were no issues of that family, so we are talking about 350 years long tradition, long family line, she made patto di famiglia, or a family pact. In her will, not even a single item of the Medici family was ever to leave the Florence. And that is why we have so much wealth and we have such a vast history of art. We have such richness in culture in Florence, because thanks to Anna Maria Luisa, it was never to leave Florence. She died of breast cancer at the age of 76. And because she was such a visionary, did she know back in that day that actually so many tourists will want to come to Florence and to see all that richness? And to conclude this talk, I would like to raise a glass, not literally, but through you will see what, to Anna Maria Luisa and to her true vision and love for Florence. It's not Pavarotti. It was public domain, free to download, so. A question. The lady is Violetta, and she's suffering from what illness? Chocolate? Who knows? Because they are talking about let's raise our glasses from a joyous cups, but actually she's dying. So what is she dying from? That was Anna Maria Luisa. She was the breast cancer victim. Did you? Here you are. Tuberculosis, that's correct. Yes, she was dying. She was, yes. So this is Giuseppe Verdi, of course. This is the end of or mid of the 19th century, early 20th century. So it's well after the Medici, but it's very nice to remember that Italy is the cradle of opera. So, okay, now time for our questions. The first question for the chocolate, if you are gluten-free, we've got gluten-free. So who is in the photo? What's wrong with this photo? You can get 2 chocolates. No, no. Do you know who these are? These 2 kids? That's Anna Maria Luisa, and that's her brother, Ferdinand. He's the one. He's the one actually that died of syphilis. What's wrong? I mean, he's wearing a dress. Would you ever say that it's a boy? No. Second question. What is the one of the most recognizable facial feature in the Habsburg family? Well done. Prognatio mandibular. Look, they all of them from the Habsburg family have like a draw. Here you are. Oh, I'll just leave it here, so please help yourself anyway. And the last question. And the last question is, what is the Italian word for passing the wind? Do you remember, you know, the little boy that taught me, you know, when instead of showing to the item, you know, he let it rip? Scureggia. And that's the end of today's talk. Thank you very much. So here we come to the end of the line. But as I said, I really would like to do a talk about Medici women because they were feral, they were wild. Another thing I would like to, if you could email me, let me know what is it that you would like to hear. And also, I plan to have another talk later this year. It is very likely that I will talk about the first early Renaissance booksellers and publishers of medical books. So if you are interested, if you have some other recommendations, please feel free to let me know. And once again, thank you very much.
Questions?
Hello.
Thank you very much.
My pleasure.
I'm impressed at how many of them had autopsies in those days. How common was it amongst the population at large to have an autopsy?
Well, if you were rich and they wanted to know how well you were treated by your doctors, you would be having performed the autopsy. I would say going back to maybe Lorenzo il Magnifico. So we are talking about mid 15th century, so they would start. If you remember in my talk about Andreas Vesalius, so that was about just after the death of the Lorenzo, they started performing, and that's when he popularized anatomy, and he was regularly performing autopsies, and he was the professor of anatomy at the University of Padua. So I would say from the time of Lorenzo's death, so 15th century to onwards, all the dukes, all the Grand Dukes had the autopsy done. And I was really impressed to see how detailed these autopsies. So one thing that I've noticed, they didn't take the brain out. So very often there could be some lesions in the brains. So there are lacking some descriptions in the autopsy reports, but all the visceral organs, everything, all the changes were always recorded. Yes. Yeah, very likely. Paul?
I was just struck with that picture of the 3 people that was just before. The one on the right had a very odd neck.
Yes, but they were all
I mean, it was a very, very weird
That
neck.
was the boy. That was the boy.
Yeah.
That was the boy.
Yeah, look at that neck.
Oh,
That
sorry.
looks like he's got some congenital thing missing.
He was the one that was supposed to become a Grand Duke, but because of syphilis and that sexual transmitted diseases, they seem to be coming and going quite a lot. Even Gian Gastone, he was supposedly suffering from syphilis, and he liked boys because his marriage to Marie d'Orleans was absolute disaster. Sorry, Gian Gastone, he was with a Czech woman, Anna Maria Saxe-Löwenburg. Yeah, so it was when they didn't know, what to find. They would say, oh, he had preferences toward men, or he suffered from syphilis, and that's something. I mean, can you really imagine in those days suffering from syphilis and live to the age of 71? Not really. So that's what they assigned to Anna Maria Luisa, but no, she was the breast cancer. Ferdinando I, so he was Cosimo I's son. He inherited, his brother was the first one, but then he died. So Ferdinando I was, when I studied him, so he had a very short neck, and he was, he's the one that I said, well, it's quite good looking, he had like this, and he had torticollis, so his shoulder would be like this, and he was, there were descriptions that he had that mild hunchback. So that was something. So I thought that they all had that spine degeneration and the uricemia. They all had the problems with the uric acid, elevated levels of uric acid.
Thierry would know this. What about artistic license from the painter, making people look taller and longer?
Mm-hmm.
I'm not sure. The comment is that in one group of painters called the Mannerists, they portrayed the human body very long. The neck was very long, the hands were very long. Sometimes the fingers were a bit twisted. It was called the Mannerist movement in the mid-17th century. So it's possible. Good. Yes, artistic license.
But if you remember, Cosimo II, he was the one that was suffering from tuberculosis, and he was the one that died fairly early, at the age of 30. So he was showing all that, very thin, very slender face, even though he had a lot of garment around him to make him look, look a little bit fatter. But actually he was all, you should see his wife. She was fat. She was, like, oh, mean. You wouldn't want to meet her in the evening, at night.
Other questions? Well, if there are no more questions, I'd like you please to join me in thanking Mirjana for a wonderful talk.
It's been a pleasure.